During pregnancy, a lot of problem is seen by the pregnant females, out of which the constipation is one of the common problem seen in 15 to 40% of the female, most common in their last 3 months of pregnancy. So, when it happens, when you are passing stool for less than 3 times in a week, and when the stool is so hard and dry that you will feel pain and feel very uncomfortable while passing the stool, it is termed as constipation. So why it happens? Number 1, pregnancy hormone progesterone relaxing the bowel, making the food to stay longer in the large bowel, absorbing lots of moisture out of it, making the stool dry and hard. And when you are not eating enough fiber and fluids in your diet, sometimes the women taking the iron supplements in the pregnancy can be the cause of constipation. And if you are not enough active in your pregnancy, in order to get rid of it, start listening your body. Go to the toilet as a part of your morning routine, and whenever you feel the urge. Some of the pregnant female, they feel difficulty in sitting on the toilet seat. You can use a stool in order to maintain the balance of your body. So next is the water intake. You should have the adequate water intake daily in order to maintain the water balance in your body. In the pregnancy, you should have at least 2 liters of water in a day. Apart from that, if you are living in a hot and the humid environment, the daily water intake should be increased. So if you're feeling difficulty in having the water, you can add in your diet the clear soup, the juices, lemon water. And keep in mind, the dehydration is one of the most common cause of constipation in pregnancy. And in pregnancy, your body needs extra water as it's making blood for the circulation of your baby. So keep a watch on your daily water intake in order to avoid the constipation. So in order to get rid of this problem, you can have the dietary changes which include the adequate fiber intake. The daily recommendation for the dietary fiber should be at least 25 to 35 gram. So what are the good sources of these dietary fibers? The various vegetables like the green peas, carrot, potatoes and the sweet potatoes, broccolis are the few options. Few of the fruits like the apple, peas and the berries are also a very great source of the dietary fibers. Try to opt for the whole grains and the brown rice and the nuts. So what is the function of this fiber? They are basically of 2 types: the insoluble fibers which improve the water reabsorption and add bulk to your stool, and the soluble fiber, they improve the friendly bacteria. So in order to get relief from the constipation, you need the insoluble fiber. So next option is exercises. Exercises in the pregnancies are absolutely safe, and try to remain as active as you can. As per the recommendations, you can do 30 minutes of moderate exercise in a day for at least 5 days in a week. Try to avoid the exercises which have high impact on your tummy. So what does it do? Basically, they will help in your bowel to keep on moving and avoid you from the constipation. So even after trying all these lifestyle methods, you are not relieved, you can consult your doctor for some medicines called as laxatives. What these laxatives do? They will help in making the stool softens, or they will increase the movement of your bowel so that the stool can pass easily. So various types of laxative available, but keep in mind all of them are not safe to be used in pregnancy because they can stimulate the movement of your uterus, and few of them cause a dehydration. So please consult your doctor before taking any laxative if you are pregnant, and avoid the home remedies like the castor oil use, the mineral oil use unless it is prescribed by your doctor. And if you're taking the iron medications, you can either change your brand or please increase the intake of water if you are having the constipation while changing these medicines. So these are the few points which you can keep in mind. And the most important is, please avoid the fast food, highly processed food and the alcohol consumption because they are devoid of the fibers and the nutrient, and the constipation will not affect the health of your baby. So follow this lifestyle or the medication method if you have constipation.